Hi, I'm Lacey Nobles of the City of Lubbock. We're going to start our news conference in just a few seconds. Okay, good morning and thank you for joining us on our new day for our COVID-19 news conference. Today we'll have updates from our Director of Public Health, Catherine Wells, Local Health Authority, Dr. Ron Cook, Steve Massingale, co-chair of the Lubbock Economic Recovery Task Force, and his fellow co-chair, Robert Taylor, and Lubbock Mayor, Dan Pope. So let's start with Catherine Wells.
Good day. Today I will update you on the current numbers of COVID-19 cases here in Lubbock County and also review some of the activities of the health department. The department is currently reporting 630 cases of COVID-19 as of yesterday evening, May 19th. Of these, 401 are fully recovered and we have 179 active cases. Over the last week, the department has reported an average of 4 or 5 cases a day, and the number of active cases has dipped below 200. These are all great signs for our community. The department is also encouraged that it has now been 3 weeks since Texas started reopening, and we have not seen a jump locally. The department continues to be cautiously optimistic, but will continue to be staffed 7 days a week, including the upcoming Memorial Day holiday, to monitor cases and conduct those critical contact investigations. We must continue to stay the course. This is a community effort. We need to limit gatherings, be smart when you are out and about, continue to practice social distancing, and wear a face covering. Wearing a face covering is not just to protect yourself, it's also to protect others in case you are one of those who's either asymptomatic or early in the stages of the virus and don't know you have it yet. Over the next week, the health department will also work to increase testing in our nursing homes. Last week, Governor Abbott issued an order that all nursing home residents and employees across the state of Texas must be tested for COVID-19. The health department and Lubbock Fire and Rescue have reached out to these facilities to offer our assistance in meeting the requirement. Over the next 10 days, the health department and trained personnel from Lubbock Fire and Rescue will be working in the majority of our nursing homes to conduct this testing. We don't have a reason to believe that we will find new cases through this effort, but if we do, we will work diligently to make sure that we contain any new pockets with these most vulnerable group of individuals. That concludes my update for today. I hope everybody has a great rest of the week, and I'll turn things over to Dr. Cook.
Thank you, Catherine. I appreciate that. Let me commend Lubbock again for doing a good job in keeping our numbers down. You must, though, continue to do your social distancing, wearing your facial covering, staying home if you're sick, getting tested if you think that you're sick. We have plenty of access for you to get tested. And let me just reiterate about the facial covering. I know a lot of people don't like to wear those, but just to say it again, it's to protect other people. If you're asymptomatic, if you're shedding virus and you don't even know it before you get sick with the symptoms, that you could spread it to somebody else. This is the very reason why surgeons, and when we do procedures on you in a sterile environment, that's why we wear a mask. So I don't give the patient whatever I may have. And that's why we do that. So let me just encourage you to continue to wear your facial coverings when you're out and about and around other people that's not your family. The other thing I want to talk to you about today is you may have seen in the news media about this COVID condition in children called multisystem inflammatory syndrome in children, or MIS-C. So initially, we thought children do pretty well with this disease, and for the most part, they do. And this syndrome is actually very, very rare. But as we look back, and we can look back to China, and we can look to Europe, and now we can look to New York City, we can see all these cases, and now we start to see clusters of different presentations of disease as they come up. And so what we're seeing is some children are actually very much affected by the COVID virus. And it may show up as late as 2 or 6 weeks later after they've been infected. And so some of those symptoms, what I want to go over with, are some of those symptoms that children get that you need to pay attention to. And some of those symptoms include fever that may last more than a couple of days, high fevers, not just the fever that goes away and doesn't come back, but a fever that lasts 2 or 3, 4, 5 days. If that happens, you need to let us know. They may develop a rash. We've talked a little bit about COVID toe, or if you've seen pictures of COVID toe, but this is a whole body rash. It's on the chest and on the back and on the arms and on the legs, kind of a bright red rash. And the kiddos may get conjunctivitis or redness and inflammation in their whites part of their eyes. So we call that conjunctivitis. They may develop a stomach ache, or they're not wanting to eat. We call that anorexia. They may develop vomiting or diarrhea. They may develop very bright red lips, and sometimes they get swollen and even crack. They may develop a bright red tongue, and it may swell enough where the taste buds turned into look like strawberry seeds. So we call it strawberry tongue. They also may develop swollen hands and feet, and the skin kind of sloughs off, kind of like a sunburn. And so this syndrome is called multisystem inflammatory syndrome in children. So if you see those things, and I'll go through them right quick again. So a rash, fevers that last more than a couple of days, conjunctivitis, stomachache or belly pain, diarrhea, bright red lips, a swollen tongue, a strawberry tongue, swollen hands and feet. Those are all signs of inflammation. That's the multisystem inflammatory syndrome. So if you see those, please let your healthcare provider know, your family's physician, your pediatrician, your advanced practice provider. Please let us know, and please let your providers know, and the providers need to let us know as a health department. This is reportable right now. And so kiddos do very well, but we want to make sure we stay on top of this. There are no cases in Lubbock. I've talked to Covenant Children's, I've talked to UMC Children's. There are no cases in Lubbock, but we need to keep our eyes out to make sure that we don't see this coming on. And if you do have those symptoms, reiterate, please let us know. That's all that I have today. Good job, Lubbock, in keeping the virus away. I'm going to hand it back to Lacey. Thank you, Lacey.
Thank you, Dr. Cook. And now for updates from the Lubbock Economic Recovery Task Force, or LERT. Our co-chairs Robert Taylor and Steve Massengale, and we'll start with Mr. Taylor.
Okay, thank you, Lacey. It's good to be here. Just want to pass along some things maybe that I've learned mainly through working through this task force and the information we've received and passed along, and also maybe learned through operating a business through what's going on with this COVID. First of all, I think it's important to realize there's about 3 major basic things that when we look at a business that we recommend that they use these 3 basic things, and most of our rules and suggestions revolve around these 3 basic things. First of all, and you've heard a lot about it, is distancing. And I think the mask part is part of distancing. It decreases the chance of spread even at a closer range. So those 2 used together are important. Number 2 is reduce or sanitize or eliminate all common touch areas. So any place that one person comes in and touches after another, the best is to eliminate those in your business practices. If that's not reasonable, then it's to reduce or sanitize after each use. And number 3 is to avoid long time in closed exposure in a crowded area, whether it's inside it or especially if it's inside in a building or an area. Just avoid those situations. So I think when you go into business, you should look for those telltale signs to see if that's something that you'd be comfortable in. I think our goal on the task force is not necessarily to return to normal, but it is to balance our health concerns with our economy. We want to open our businesses and our lives as fast as we can. We want to do it in a manner, though, that we control our health concerns. And the best job we do, or the better job we do in handling those and getting those to level will mean that we will be able to open more and do more in the future. And that's our goal, to see how much we can get open and return people to a life of and to an economy that they're used to, and yet control our health concerns. And I think that points out what we tried to do and what we tried to explain through Lubbock Safe. And Lubbock Safe is a program that I think you should look for. I think it's something that you know that the proprietors of that business or that event have really tried and subscribed to going above maybe some things, but it applies those 3 rules that I talked about. I think that's very important. And to date, we have 774 businesses that are Lubbock Safe. That's a 31% completion rate of the ones that have started. But I think with the next round of openings, you'll see more and more out there. And I think that's important for us to control what we see in this community so we can continue the progress that we've made so far. With that, I'll turn it over to Councilman Massengale. First of all, thank him for his work and the task force work. So, Steve.
Thank you, Robert. Thank you very much. Good morning, everybody. As you know, the governor spoke on Monday and opened up another series of businesses. Our Recovery Task Force Committee on Get Lubbock Open met yesterday to work on guidelines that apply to those businesses that opened immediately and that those will open later in the week. I'd like to go over those so that we're all clear on that. One is he's opened up the balance of personal care businesses, and that includes businesses that provide massage services, tattoo and piercing businesses are included in that. He's allowed youth sports to occur as it applies to practice, youth sports without spectators. There'll be a time, I believe in June 15th, when he'll allow youth sports with limited spectators. He allowed bars on Friday to open up to 25%, and he's turned the dial on restaurants to 50%. He gave us guidance on childcare on Monday that was effective immediately, and we visited with many of our local childcare operators, get their feelings on this, and I'm hopeful that the governor will modify what he's done, because he's actually, in our opinion, restricted some of those businesses more than they were previously. And that applies to, they've given some guidelines on ratios and teacher student ratios and how they transport them. And so we've communicated with the strike force on that, and we're hopeful that we get some guidelines that maybe make a little more sense for our childcare operators here in Lubbock. Summer camps are going to get to open on May 31st. And I think I already mentioned youth sports. So our recovery task force will work on guidelines that apply to all of those various events and industries, and we'll get those posted up as soon as possible, because we want all those entities and events to be Lubbock safe. You'll also notice on our website that you'll see some reorganization of some of our categories. We're aware that some of those might be a little confusing, and that's kept some folks from getting Lubbock certified as Lubbock safe, and we want to make that a little bit easier. Our recovery task force will meet as a group tomorrow afternoon. We're going to get updates from our various committees, but we're going to focus on large outdoor group gatherings as our community, as we warm up, the weather gets warmer. We know there's many events that our community loves to participate in, and we want to make sure that we have a safe set of guidelines for those groups to be able to operate their events. I would just close with, I noticed that as we went on the air, the CDC and the White House just released a 60-page document, guidance on reopening the economy. I got to glance through it. Much of that is what we've already done in Lubbock, and much of that we've done is what's got us to the place where we are today, and that is where our numbers are with COVID-19. And I think the mayor's going to go over those, but we continue to rely on that science to make our decision on what's safe and responsible. And I know we overuse the term "stay the course," but it's so important. I mean, this week we're not back to normal, and I've observed some folks that think we're back to normal, and we're not. We must continue doing what we're doing to ensure that we can operate in a safe manner moving forward. I'm so thankful for those businesses that have participated in Lubbock Safe, and they've set the example. It's so important that we have leaders in our community that set the example and understand that we must continue to sanitize, we must continue to cover our face, and keep our social distance. Two terms come to my mind as we maneuver through this, and that's good judgment and common sense. And you know, when you're using good judgment and common sense, and you can detect very quickly when an organization, a business, or event is doing the same thing to your benefit. And with that, I will hand it over to Mayor Pope.
Thank you, Steve. Good morning, everyone. I'm thankful for Mr. Massengale and Mr. Taylor, also for Dr. Cook and Ms. Wells. We've got a great team, and it's good to work with you guys on a daily basis. I want to share my screen and run through some data slides. Okay, these slides, as always, are available on the City of Lubbock website, mylubbock.us. Click on the coronavirus tab. It'll take you straight to our page where these are updated every afternoon. This slide 2 today is our little data around our deaths, and we've been fortunate to not have a death in a number of days. But I want to point out that all but 2 of our deaths have been people over the age of 60. And when we talk about face coverings and why we wear them, often we are trying to maybe not as much protect ourselves. We may not be vulnerable, but there are people in our community that are vulnerable. It's just another thought as go back to that common sense piece. I'll move on through. I'm not going to spend any time on the demographic slides today. I am going to get to my key slides, the last 4 slides. Active cases by day. So we're now well more than twice as many recovered cases as active cases. So that means I think we have 179 active cases as of today. So right on the on a very good track. Our new cases today makes 3 weeks since we've had a day with more than 10 new cases. So once again, a very positive trend. Our hospital data, our hospitals remain strong. We had a chance to talk to the CEOs of Covenant and UMC earlier this week in a brief phone call, and made sure that we got an update from them. Things are going well there. Their business is restarting. Their more traditional business is restarting, and that's good news for our economy. And then finally, testing. You can see that our number of tests continue to grow. We've reported, I think, 400 tests yesterday, more than 400. There have been nearly 13,400 tests done to people in Lubbock County. That's still just a little less than twice as often as any other Texan would be tested. So we're testing it just at nearly 2 times the rate. Of those tests, less than 6% of the people that are tested are positive. And that number continues to come down, and that's what we want. That's, as we test more people, we believe that we'll find people that aren't positive. However, we want to know, because if someone is positive, then we can put in place our public health initiatives, and that's that tracing, that that investigating and building a fence around them, letting them recover, as the vast majority do, and then we can go back to our lives. Okay, I believe I'm back now. Let me make a few other comments. I want to pause and always remember those that have been impacted the most by COVID-19. I was talking this morning we had a question at Coffee with the Mayor this morning, and the city manager was helping me answer the question. And he said that our solid waste, our trash collections over the last 2 months are nearly double the average rate. So when we think about the people, we're all home more, we're cleaning stuff out, we're probably doing things we never thought we would do. But think about folks that are picking up our trash or delivering the food to our stores, or certainly protecting our streets and our homes and our businesses, or maybe most importantly, at our hospitals and our doctors' offices that we can count on. And I know you all join me in being thankful for and empathetic for them. I think about the businesses that have been impacted and the families that have been impacted by this virus. And so it's important, I think, that we don't forget where we are. Now, progress is being made. We must remain patient. There's no one in Lubbock that has more challenges with patience than I do. My mother always joked that I didn't last long. I didn't stay long at the patience station when I was being made. But we continue to learn. We learn daily. We learn about vaccine progress that's being made. We're watching closely what's going on in the Southern Hemisphere, where it is winter now, becoming winter, and we're watching what's going on with this virus in that part of the world. We're going to continue to test and to trace and to tweak our strategies. But it is important that we go back to work. Main Street must survive. Our small businesses must survive. And we can safely reopen. Consumer confidence is growing. And I believe a big part of that is our businesses saying, yes, we're going to be safe, but we're going to be in business. We're going to protect our employees and our clients, our customers. As I've said before, that we all want the very best science and information, and we need safe environments for ourselves and for our families. And we desire that freedom we have as Americans to go and do as we see fit. I really believe we are on the right path to recovery. Keeping our community safe by practicing safe social distancing allows us to move quicker into startup. And so turn loose that West Texas spirit, check on your neighbor, enjoy Memorial Day weekend. Don't forget the men and women who've given the ultimate sacrifice. That's what we celebrate on Memorial Day. Start the summer. Let's do it safely. Okay, let's do it safely. Please be safe, be kind, and remain hopeful. Back to you, Lacey.
Thank you, Mayor. Now we'll open it up to media questions. I'll ask all the panelists to start their video. And here is today's media question order. We have Matt Dotre with the Avalanche Journal, Blair Sable with Fox 34, Christy Martinez Garcia with Latino Lubbock, Matt Stell, KMAC, Olga Aguero, El Editor, Karen McKay, KCBD, and Terry Furman with KOBK. So let's get things started with Matt Dotre.
Thank you, Lacey. Hey, everyone. Ms. Wells, can you talk a bit more about the testing at nursing homes? So it's just the swab testing, right? Not the antibody testing. And can you tell us a bit, maybe kind of a time frame you expect?
Hi, Matt. Last week, the governor put out an order that required all nursing home employees and residents to be tested, and this is a regulatory requirement. So the health department has offered, along with Lubbock Fire and Rescue, to test to help those nursing homes meet those requirements. It will be a nasal swab, so the same PCR test that's available at the UMC drive-through clinic, the City of Lubbock drive-through clinic. They're not doing antibody testing right now. The goal is to get this completed within the next 2 weeks, would be our goal, to kind of get everybody tested at the same time.
Okay, thank you. And then Mayor, and I guess Councilman Massengale too, you know, a lot of people are watching Amarillo and following what's going on in Amarillo. There are some people that travel back and forth. Has there been any discussion about, you know, maybe strongly or advising people or even mandating it not to go to Amarillo at the moment?
Well, Matt, I'll start and I'll let Steve add on. You know what I'm going to say, but I'm going to repeat it. And I think I'll sound a lot like Mr. Massengale a minute ago. We want people to make good decisions based on common sense and the facts they have available. And I've said before, and I'll say again, I think you should not travel to hotspots. Amarillo would be one of those. El Paso is one. You saw yesterday where the federal government extended the non-essential travel ban to both Canada and Mexico, our neighbors. I mean, we don't need to be traveling to places where there are hotspots. And I would encourage people to get on the phone and do it that way, get on a Zoom call, do it a different way. But I do think things are better in Amarillo. I've talked to Mayor Nelson a couple times this week, but I believe they've got a ways to go. And I would suggest a Lubbock resident to not make the trip.
I'll add on to that. The threat still exists. You know, I am concerned about Amarillo, but I hope that people, like the mayor said, I'll go back to my 2 terms, good judgment and common sense. And hopefully if you're paying attention, you understand it's not a good decision to head north and spend any time in any of these places that might have the COVID-19. So for those people that don't believe, all I can do is reemphasize is that there is a threat. And that's why we continue to implement these strategies to keep our community safe. We have not eliminated the threat. What we've done is we've learned a tremendous amount about the virus. We've learned how to contain and isolate the virus when we detect it, and we know how to keep our people away from it. But use common sense, use good judgment.
Okay, next we'll go to Blair Sable with Fox 34.
Hi all. My first question is about the city. Are there any plans to reopen community centers at this point and resume the events that would usually be held at these locations?
Yeah, so good question, Blair. We worked, talked about that in our work session, city council meeting a week ago yesterday. And I believe we will update next Tuesday at our work session, our council meeting on that. We would love to do that, but we only will do it when we feel like we can do it safely. And we've got, in addition to community centers, let's go ahead and put pools in that same, and summer camps we do for kids. We've got some things that our community really counts on. So I don't want you to think I'm dismissive about it, but we want to do it in a safe way. And the governor gave us a green light on some of those things just Monday. So we're working very diligently on that right now.
Thank you. And my second question will be for Catherine Wells. So the governor's office recently just sent out a press release this morning about remdesivir being sent to our local hospitals. And it mentions in the press release that a few initial cases were sent the drug across the state. So I'm just wondering if the health department knows if any of those, like if remdesivir has already been utilized in our hospitals for any existing cases.
I don't know specifically. I don't know, Dr. Cook, if you have.
So I don't know that it's been used. My assumption that it probably has. University Medical Center received one case, which contained 40 vials, and that 40 vials is one vial per patient. So we have enough for 40 patients to be treated with remdesivir. Amarillo received 2 cases, primarily because of the number of positive COVID and hospitalized patients they have. So, but here locally, we received one case of remdesivir.
Okay, next we have Christy Martinez Garcia with Latino Lubbock.
Good morning, everybody. Dr.
Morning.
We had someone call us that had the swab molecular COVID testing, that is, and while they were waiting, their results a couple of days later got extremely sick, and they went to the emergency room, that is, where they had the rapid test. And 15 minutes later, they got a negative. However, while they were waiting to see the doctor, they got a call from their regular doctor's office informing them they had positive. That being said, should those that did the rapid COVID tests retest since they're not reliable?
Christy, you know, this is the problem with some of these tests hitting the market so fast and getting them approved. And there are false positives and there are false negatives. And so I would take it, you know, once you have a positive test, then you're going to have to assume that you're positive, whether it's a true positive or a false positive. None of these tests are perfect, either the short acting one or the rapid return one, or the one that you have to wait a couple of days that's sent to Austin and you get it back. They both, again, have false positives and false negatives. But once you test positive, whether or not it's a real positive or not, you must assume that it's positive and be treated as if you were positive. So self-isolate, get away from people, stay away from people, so that you don't infect other people. So none of the tests that we have, including the antibody test, are absolute good tests. They're not perfect. And so we must continue to put it with the constellation of symptoms that they present with. And if you feel like you've been hit by the bus and you've got all the symptoms, and even if your test is negative, you need to stay at home. If it's positive, you need to stay at home. If you've got all the symptoms, you stay at home 10 to 14 days till you feel better.
Thank you. Catherine, we have had some folks that are calling that at their work site, they've had individuals that work there but live in another town. Have we had any issues with numbers being reported because they live in another city? Also, have we had any issues with results at the Patterson testing site?
The individuals, everybody that we're reporting in the official City of Lubbock number is a resident of the City of Lubbock or Lubbock County. There are individuals that get reported to the health department, and if they live outside of that county, we report it to the individual or to that local authority.
Have we had issues with the Patterson testing site?
No, we've had, it's the same test that goes over to, that we use at UMC. I know of one mistake that happened with a laboratory swab. Other than that, everything has been great at that testing site.
Thank you, Christy. Now we have Sarah Self-Walbrook with Texas Tech University Public Media.
Hi, everyone. Looking at some of our numbers that the mayor showed this morning as well, Lubbock's Hispanic population has been particularly affected, accounting for about 45% of cases and 36% of deaths. Catherine and maybe Dr. Cook as well, based on contact tracing and the investigations y'all have done into cases, are there any common trends or specific reasons this population has been so affected?
Well, I can answer that. I think, remember most of those cases that were related to deaths and were associated with a nursing home here. And I don't know the demographics of the employees of that nursing home, but But most of those that you see there are, you know, they're frontline people in the workforce, and so that's the way it's worked out. I don't have a good reason of why it's 49 or 45% Hispanic, as you mentioned. So.
Sarah, I would just add that the when I look at the numbers, I think it's a really good question. When I look at the numbers, the death piece is not is I don't think it's disproportionate. It's very close to the community as a whole. I do think from a positive standpoint, you could make that case. And Catherine, I might ask you to continue to maybe comment more on it. I don't know that we have any deeper data.
And I think the trends with high numbers of Hispanic positives is something that we've seen across the United States and in Texas. And it's really something that we're going to need to follow. I'm not going to have a good answer for exactly why. That's something that we'll have to study in the future.
Thanks, all. That's all I have.
Thanks, Sarah.
Okay, now we have Matthew Stell with KMAC.
Thanks, Lacey. I've got two quick questions. My first question is for Catherine Wells. Catherine, I see we've had over 400 recoveries. We've doubled the amount, double amount of active cases, which is good news. But we have a lot of people who are wondering, how are the recoveries determined? Are they retested again? Just kind of explain that process. How do we know we've had or somebody has recovered?
Retesting is not the CDC recommendation for recovery. We are using the CDC's guidance with symptom checks. So health department staff follow up with all of our cases. We call them every other day, every day, depending on the severity of their disease. When they have been, when it's been at least 10 days since their diagnosis, plus they've been 72 hours without any fever, and then a significant reduction in those in their symptoms, we will say that they are recovered. We are seeing people wanting to go out and do a second test, and we've seen employers wanting a second test. That is not the recommendation from CDC at this time. The only people where they recommend a second test is elderly individual or someone returning to a nursing home, or someone in a nursing home to remove that isolation to require that second test.
Gotcha. Okay. My second question is for Mayor Pope. Mayor, just kind of give us the status of, swimming pools here in the city. I don't think we've heard anything in the past couple of days.
Matt, are you talking specifically city pools?
City pools, yes, sir.
Yes, we've not made a final decision on city pools. We talked about it last Tuesday at our council meeting. Staff continues to work on it. I think you'll hear something from us pretty quickly on what our plans are.
All right, thank you.
Okay, next we have Olga Aguero with El Editor.
Good morning, everybody. Can y'all hear me now?
Yes.
Yes.
Gotcha.
Okay. I've asked this before, but I don't know. I wasn't given an answer back then, but I'll ask it again. As for what procedures will be in place once we're totally 100% open, or even before, as for those that are coming in from out of state to Texas, will they be asked to quarantine or follow procedures at that time?
Well, that's a good question, Olga. That's I think right now a hypothetical. I think we'll even when we reopen 100%, there very well may be some travel restrictions. I was at the airport last week. I was not traveling, but I was looking at the renovation work at the airport. And while there, I had a chance to talk to the highway patrolman who was stationed there and is the one that goes through the quarantine protocol with the people that are flying in from New York and California into Detroit and Atlanta and New Orleans. Ron, I think I got the list. I'm not sure if I got it exactly right, but we see a manifest on every flight coming in, and the people that are coming in from those areas are go through, sign some paperwork, and are asked to quarantine for 14 days.
Okay. Before I ask my second question, I just would like to say we appreciate everything that y'all have done. Lacey organizing all these Zoom conferences and all the information that's being provided by all of y'all. We appreciate it very much. My last question is either for Dr. Cook or the mayor. Is it safe, or should people be told not to take that deadly medication that our president is going around saying or recommending?
I'll let Dr. Cook handle that one.
You broke up a little bit at the beginning, Olga. You're asking what my recommendation is about hydroxychloroquine?
I would say, Dr. Cook, is it safe, or should people be told not to take that deadly medication that our president is going around recommending and saying to take it?
Olga, I think your key word there is it's certainly potentially deadly. We don't prescribe medicines willy-nilly, and we have to weigh the risks and the benefits of the drugs that we prescribe. And so we certainly, that drug is well known for cardiac related issues, conduction issues, and it can cause certainly some cardiac issues. And it's people who are more mature, older, have significantly increased rates of heart disease. And so it's not a good idea to take a medicine that's not prescribed by a physician. And so the studies out there now show that it didn't really help much. If he convinced his provider to write it for him, then it's a discussion between patient and physician, and it's his prerogative, their prerogative. So our studies show that it doesn't help much. We use it for other things, but not for that now.
Thank you, Olga. Our last media question is Terry Furman with KLBK.
Shoot, sorry, I thought that someone was before me. I want to ask about Joyland. Several people, Joyland has questioned whether or not they can open. And I know the governor hasn't really addressed this point yet, but would you be supportive of Joyland reopening in the future?
Okay, I'll start, Terry, and I may let Steve or Robert add to it. So first and foremost, the governor has addressed it. He had a specific question about it on Monday at his conference. We would like to get Joyland reopened. Joyland is an important part of our community. They have been for several generations. Local ownership, they're accountable. It's clean. It's a place where people want to take their kids and their grandkids. They're an important part of the fabric of our community. We believe they can open safely. And we are working closely with our two local members of the governor's task force to try to get Joyland reopened. And maybe there's a way you can prove that you can open these much bigger amusement parks by safely doing it at Joyland. But the answer is, for me, is an unequivocal yes. I think they should be and can be open. We're working to that end right now.
I can't add too much more to that. The mayor said it well. There's been a lot of unfairness throughout this whole process as we've made, or as the governor's delivered directive on how to reopen. But, Joyland has various things out there that I think if you put them all together, a lot of those things are open today, food service, and I think they can socially distance in lines and use good common sense, sanitizing and encouraging face coverings. And so we'll continue to send that message to the governor and hopefully make some headway for that business.
Okay, great. The other question I have is about, obviously it's a big weekend. People are going stir crazy. They want out. And so the lakes will be packed this weekend. Are we doing more any enforcement locally with the county per se, or even out at Lake Allen Henry? Are we pushing up patrols, I guess, out there to kind of watch to make sure that people are socially distancing and being careful?
Well, yeah, it's a great question, Terry, and let's all be very careful this weekend. We've worked with the county. I know that the county's worked with Buffalo Springs and Ransom Canyon and put in place some precautions. In our case, at Allen Henry, the answer is yes. We will have extra patrols there. We do that this time of year anyway, and we'll work with game wardens and the state in that regard. But our folks will be there, and we're going to encourage social distancing. But the main thing we want on the water is people to follow all your water safety guidelines, your rules. Having spent a lot of time on the water in the last 15 years with kids and in a boat, and we just need to be safe. We need to be careful, and there's a right way to do it. We want everybody to come back from the lake. Okay.
That's it for our media questions. I want to thank you all for joining us, and thank you to our panelists and our interpreters. Our next news conference will be next Wednesday at 11:30. We'll see you then.